name is Kelly Patterson. I'm the clinical nutrition educator with Omega Quant. And today we're going to talk about supplement labels as they relate to omega-3s and how we know what we're getting and how we can choose the best products for us. All right. So quick conflict of interest. I am a contractor with Omega Quant, and we do have a supplement brand, Parasol Nutrition. So just as an FYI. All right. So we're going to go over kind of some overarching facts about supplements in general, just so we have an understanding, kind of shared understanding, and then we'll go over some details that are a little bit more specific to omega-3s and those products individually. Some learning objectives for today. All right, let's dive into it so we don't waste any more time. So just to kind of start off at the top here, kind of the wide world of supplements. Like I said, I'm going to start really, really broad and then kind of get a little bit more granular as we go through. Dietary supplements are a huge, huge market. There are over 100,000 different dietary supplement products on the market. And within that kind of large umbrella, there are thousands and thousands and thousands of omega-3 supplements types, brands, all over the place. There are a lot of high quality brands and products out there, but they can be difficult to find. It can be really difficult to kind of sort through what's good, what's not so good. There are a lot of different factors to consider. And part of those factors, things like dose, sourcage, additives, just deciphering a supplement facts label in and of itself can be kind of tricky if you're not sure what you're looking for. A little bit about supplement regulation. I bring this up a lot when I talk about supplements because I think it is really important to understand why we have to be so careful about what we're choosing when we're looking at supplements because of the way supplements are regulated differently than foods and very differently than kind of prescription medications or other medications. Supplements fall in this weird gray area. They have their own very unique set of regulations and how that works. And so that definitely has an impact on how we should evaluate products for ourselves. So contrary to popular belief, the FDA does have some role in supplement regulation. However, it's pretty different than what you think of when we think of FDA regulated products like food or drugs. And the highlighted section here kind of highlights the way supplement regulation, which is the responsibility of dietary supplement companies to ensure that their products meet the safety standards for dietary supplements and are not otherwise in violation of the law. If I had to boil down supplement regulation, it is that there are rules and it is up to the companies themselves to enforce those rules and follow those rules. And only when rules are egregiously broken and harm is caused is when the FDA can step in and regulate those products. So dietary supplements are required to have information on their labels, things like that. But the FDA does not have the authority to approve dietary supplements for safety, effectiveness, or to approve their labeling before dietary supplements are sold to the public. So the FDA does regulate the actual labels of supplements. Dietary supplements are the products that are considered dietary supplements are products that are intended for ingestion. Among other requirements, contain a dietary ingredient intended to supplement the diet. And that is to help differentiate between a food and a supplement. If something is meant to be part of your diet is not supplementing a diet, then that would be considered a food. All of this verbiage gets really granular further and further regulations you get, but dietary ingredients are defined as vitamins, minerals, herbs, botanicals, amino acids, dietary substances that are part of any part of the food supply, concentrates, metabolites, constituents, extracts, or any combination of those dietary ingredients from the preceding categories. So omega-3s would fall in there under dietary supplements that are substances that are part of the food supply and concentrates of a dietary product. So omega-3s, if you think of fish oil, that is a concentrate of something that is part of the food supply, which is fish, right? So the FDA does require that all supplements on the market have a supplement facts label. And a supplement facts label differs from a nutrition facts label in a couple of different ways. A supplement facts label or a nutrition facts panel must list all of the nutrients, regardless of the amounts, whereas on a supplement facts label, nutrients in zero amounts are not allowed to be listed on the label. That's because if there were nutrients of zero amount on a supplement facts label and they had to list them all out, the supplement facts labels would be really long, because if we're talking about something like a multivitamin, there's no, carbs, fat, protein, those types of things in a multivitamin. There's no many other nutrients, no fiber, things like that. So the supplement facts labels are required to have a serving up at the top, just similar to a nutrition facts label. They are required to have a serving size and a servings per container. So that will tell you how many doses you're getting in a container, and all of the information that is on a supplement facts label is for that serving, just as it is on a nutrition facts label. They are required to have calories in the supplement facts label only if the item has enough calories to be considered caloric. So you may not see calories on every supplement facts label if it's something that does not have enough calories to be considered calorically significant. A dietary supplement disclaimer may appear on dietary supplements on which a structure function claim is made. So if you buy supplements, many of them will have this black box warning down there at the bottom that says these statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, or cure or prevent any disease. So oftentimes the language supplements cannot make disease treatment claims like, for instance, a supplement cannot say this product will lower cholesterol. They can't say that, but they can say promotes heart health. So they cannot, high cholesterol is considered a disease. So they cannot say that this is treating this disease, but they can make broader sort of, we call them health promotion claims. So you see a lot of that. And then that box warning right there will be kind of, the asterisk next to those claims have to be there because of the way supplement regulation works, that those claims do not have to be verified by the FDA before a company can make them. So the reason that differs from something, let's say, like an over-the-counter drug like ibuprofen, for instance, in order for ibuprofen to be sold and to be marketed, the company that produced that when it was first introduced to the market had to prove to the FDA, for it to be considered a drug, an approved drug, they had to prove to the FDA that it was safe and effective for the conditions that it was claiming to treat. Okay. And that's the same with prescription drugs as well. Those drugs cannot be approved until they are proven through many stages of approval process with the FDA that they are effective for the conditions that they treat and safe enough with tolerable risks for the patients that might receive them. That is very different than the way supplements are regulated. So this is just some of the stuff you may see on a supplement facts, nutrition facts label. I'm going to go over some more detailed examples in kind of the second half of the presentation. This is just kind of a broad overview. All right, so continuing on with supplement regulation, I talked about how there's no really pre-approval for these types of things from the FDA. There is a regulation requiring all supplement manufacturers to follow what is called good manufacturing practices, but enforcement of this is pretty weak. And the manufacturers can put a GMP label on products claiming that they are in some way certified for safety, but these labels are pretty meaningless. So you may see these little certification medallions or whatever or stamps on supplement bottles, but they don't mean anything. All supplement manufacturers are required to follow good manufacturing practices. In fact, many manufacturers across many different areas are required to follow good manufacturing practices. This is just a minimum requirement. GMP certified does not mean anything. If they're not following GMP, they're already breaking the law. There is no like certification for it. It's just a good manufacturing practice that is required to be followed. So if you see these, this does not mean it's been tested for safety, efficacy. This is not third-party testing. I'll talk about that in a minute. But just important to note that. All right, this is another thing you'll see on a lot of supplement labels is you'll see these little medallions, they look like certifications. This one I just pulled off of a website. This one says like natural, 100% natural, GMO free. The third one there says just lab tested with a little beaker in the middle. I'll give it, points for creativity, but none of those actually mean anything. They've not been certified by any outside groups. Unlike food where it can't be like USDA or organic, something like that, that is supplements do not have that labeling. So when you see these on a lot of different products. It doesn't mean the supplement is bad. I want to be very, very clear. It doesn't mean the product is bad. They don't mean anything. They're a marketing tool. And so it's just something to keep an eye out for. Again, doesn't necessarily mean that the product is bad, but it's not necessarily, again, a sign that it's been certified by anybody. All right, I mentioned third-party testing. There are third-party verification agencies that supplements can certify with on their own, and these places will do ingredient verification and dosing accuracy. Again, none of these groups will certify for safety, and none of them will certify for efficacy. So it still doesn't mean a product is good necessarily, but if we're talking about something like fish oil, which we know can have a lot of benefits, having a product that is third-party certified will mean that the ingredients in it have been verified and that the dosing has been verified as well. So these are just a couple of organizations that will do this: USP, NSF for sport, Informed Choice for sport, and the BSCG will also do, there's also another one, Consumer Lab, that does third-party certifications as well. So if you are looking for a new fish oil product and you want to find something that has been third-party certified, I would recommend you go to one of these websites of these companies, and you can look for products that have been certified for ingredient verification and dosing accuracy. All right, so we're going to kind of skip back to the nutrient facts label. One of the things that we see on nutrient facts label are something called DRIs, which are dietary reference intakes. And this is kind of an alphabet soup of different recommendations that the USDA and the USDA has come up with for dietary recommendations and how much of different nutrients certain people should be getting every day in their diets. I say a little bit of an alphabet soup because people get a little bit confused as to what each of these mean, and they do mean different things and are used for different nutrients. So a DRI is an umbrella term for a dietary reference intake. And all of the EARs, RDAs, ULs, and AIs, they're all considered DRIs. So I think of DRI as the umbrella term. The first and kind of most common nutritional one is an EAR, which is an estimated average requirement. The estimated average requirements apply to vitamins, minerals, and macronutrients, which would be protein, fats, and carbohydrates, and fiber. And an EIR, an estimated average requirement, meets the daily nutritional intake for 50% of people. So you'll see EARs, when you hear people talk about different nutrients. And so there's EAR means it's meeting the daily nutrient intake for 50% of healthy people. Again, this is all for considering healthy people and preventing disease. The RDA, these are the most common form that you'll see recommended dietary allowance, and this is an average intake needed to meet 98% of healthy people. So when you see the RDA for fiber or the RDA for protein or the RDA for fat, like total fat, that means that for 98% of human beings, that amount will meet the needs for 98% of people. There will be 2% of healthy people that may need more or less than that. But it's like a minimum minimum need, or the 2% would be people who need more than that. This is important to note that the RDAs are not necessarily optimal amounts. They are meeting the minimum need, okay? And a lot of the times it's the minimum need for disease prevention, especially when it comes to vitamins and minerals. For macronutrients, it's a little bit different because we have to talk about caloric needs, but the RDAs are for meeting that 98% of healthy people. ULs, this is the tolerable upper intake level. This is the maximum daily intake of a vitamin or a mineral that is unlikely to cause adverse effects. So if we're talking about something like vitamin D, for instance, the UL is the amount that, we are considered to be able to take as far as vitamin D and not cause any other adverse effects. AI is adequate intake, and this is kind of the opposite of ULs. This is intakes at this level are assumed to assure nutritional adequacy, and they are used when there's supposedly insufficient evidence to develop an RDA, which is that 98% of people. And the reason this is important is because there's no RDA for EPA and DHA for omega-3s. So the RDAs are typically established for disease avoidance. So a good example of this is scurvy. We know pretty solidly that vitamin C intake, if you intake vitamin C, the way to avoid getting scurvy is by intaking vitamin C. Vitamin C intake prevents scurvy. So we know that there is an RDA, that 98% of the population of the amount of vitamin C that they need to prevent them from getting scurvy. Doesn't mean you can't take more than that, but it is seen from a disease prevention, deficiency disease avoidance versus chronic disease. So deficiency disease, scurvy is a really perfect example of deficiency disease. Chronic disease, something like cardiovascular disease, which has a lot of different factors, RDAs are typically not used for, or chronic disease development is not typically considered when it comes to RDAs. So for omega-3s, there is an adequate intake. So remember, the adequate intake is that kind of minimum amount that, most people probably need to get, but we don't know how much more they need to get. And this is the AI adequate intake chart for omega-3s from the NIH Office of Dietary Supplements. And you'll see that the only from birth to 12 months. So for infants is total omega-3s have an AI, whereas for children and adults, the only AI we have is for alpha-linolenic acid, which is ALA. The reason for that is because technically, if we only consume alpha-linolenic acid, we can convert some of that to EPA and DHA. The conversion rates are pretty low, but technically we can consume alpha-linolenic acid and produce our own EPA and DHA from that. However, when it comes to the prevention of cardiovascular disease, we cannot consume enough alpha-linolenic acid to have the desired effect for our EPA and DHA levels, okay? So although, yes, there is an AI for alpha-linolenic acid, that does not meet the adequate needs for EPA and DHA when it comes to prevention of cardiovascular disease risk, reduction of cardiovascular disease risk. And the reason that the RDA hasn't been developed is because the USDA doesn't see that there is sufficient evidence for that. There has been many attempts by research groups to try and push for an RDA for omega-3s because of the abundance of research we do have to show that intakes of EPA and DHA reduce risk for cardiovascular disease. However, the powers that be have not responded to those calls for action. So just a quick kind of sidestep here. How do we know what we need as far as EPA and DHA? We've talked about kind of supplements, and we've talked about these needs, and I'm sure if you've seen a webinar of ours before, you've heard us talking about the omega-3 index, which is our flagship test here at OmegaQuant. And the omega-3 index is a measure of EPA and DHA in red blood cells, expressed as a percentage of total fatty acids. And this is how we know that we need more EPA and DHA, and how we know that intakes of EPA and DHA will decrease cardiovascular disease risk. This is just a few studies that have shown significant decreased risk for disorders like heart disease, improved cardiorespiratory fitness, loss of cognitive function, depression and anxiety, age-related macular degeneration. Probably the bulk of research is in the heart disease and cardiovascular disease kind of arena. There is an abundance of research showing that the higher your omega-3 index, meaning the higher those levels of EPA and DHA in your red blood cell membranes, the lower your risk for heart disease. And so it's unfortunate that we don't have an RDA for that. It would be really, really helpful if we did have an RDA for that, because that can be used in a lot of messaging, change practices in doctor's offices, things like that. But until then, we kind of have to attack it on our own. And the reason this is all kind of relevant is because when we are choosing an omega-3 supplement, we need to know kind of what's our goal, what are we trying to get to, and having a test like the omega-3 index helps us get there. So raising the omega-3 index, improving your numbers, what works, what doesn't work. EPA, DHA, and a combination of EPA and DHA when we're talking about omega-3 supplements is what we want to look for. I touched on ALA, alpha-linolenic acid, and why that is not terribly effective because we don't convert very much of it to EPA and DHA. Omega-6s, omega-9s, combination oils like omega-3, 6, 9 products, those are not going to improve omega-3 index levels. And so we are looking for omega-3 products. And kind of having taken the first half of our presentation, we are looking for omega-3 combination EPA and DHA products that potentially have a third-party testing and have an adequate dose to get us to an ideal omega-3 index, which is between that 8 and 12%. So putting all of that together, let's look at some product labels and do a little talking. So this is an example, I would say, of a really high quality fish oil. And let's just go through kind of what we're looking at when we're looking at a good example, and then I'll show some less good examples. So the first thing, again, we see that serving size up at the top, 2 soft gels, and servings per container is 90. So there would be 180 pills in this bottle, meaning there's 90 servings, which is great. Value matters, and so price per how much we're getting. If you have to buy something every month versus buying it just a couple of times a year makes a difference, but that's also personal preference. So we see down here all values listed below are for that serving size. So everything here is if you take 2 soft gels. It's really important, especially with fish oil, to make sure, or any omega-3 supplement, to make sure you are looking at that serving size. Some products may have a 1 capsule serving size. Other products may have a 2 capsule serving size. And that's important because if you get a bottle that has 60 capsules and their serving size is 2, you've only got a 30-day supply, right? But if you get a comparable product that maybe has a higher dose or what have you, you may have 60 capsules and it's a 1 capsule serving, so you've got a 60-day supply. So it's just important to kind of look at that and make sure you are taking the right amount. I've had many people I've talked to who were just not taking the right serving for their product just because they didn't look, or they were taking a product before that was a 1 capsule serving and now it's 2. If they changed products. So just make sure you're taking a look at that. And if you have patients you're recommending a product to, make sure they're looking at that as well. So looking down here, we're going to focus kind of on that second half of the supplement facts label and look at the total omega-3s, EPA, and DHA. The total omega-3 is important, but you really need to see the individual fats listed. And I'll show you an example on the next slide or two of why that's really important. And adding the individual fats tells you exactly what you're getting. So in this case, you're getting 800 milligrams EPA, 600 milligrams DHA for 1,400 milligrams combined of those two. The other omega-3s that are in there, they're not specified and they don't count towards the dose. So in this product, there's only 100 milligrams of other omega-3, so it's not a significant extra amount, but sometimes you may see 200 milligrams EPA, 100 milligrams DHA, 500 milligrams of other omega-3s. It's probably alpha-linoleic acid. And that matters because you may get something like this, where you're getting, it says an omega-3 from concentrate from fish oil, 1,200 milligrams, right? Total omega-3 is 720 milligrams. But if we go down and actually add up our EPA and DHA, you're only getting 660 milligrams. So this happens a lot where they're actually saying you're getting 1,200 milligrams of fish oil, which you are, but because this isn't a very concentrated version, you're only getting 660 milligrams of actual omega-3s that we care about, that these EPA and DHA right here. So this is really, really important. I'll give you another example here. This is I don't want to shout out this brand or anything, but this is a common brand found in a lot of drugstores. But you'll see this really frequently on the front. It'll say fish oil 2,000 milligrams or fish oil 1,000 milligrams. But when you roll over the label and take a look, you see that total omega-3s, it says, 600. Oh, okay, it's 600. But when then I look down and say EPA and DHA, it's only 500 milligrams. And they're listed together. So you don't know if you're getting 490 milligrams of EPA and 10 milligrams of DHA. No idea. No idea what the distribution of that is. And while it's not incredibly important that you have an exact ratio of EPA and DHA, it is important that you are getting both in whatever product you're getting. So this is a really common for less expensive fish oils. If you have patients or if you yourself are shopping for a product and you're seeing stuff that seems significantly cheaper than other brands, this may often be the culprit in that it advertises 600 milligrams of actual fish oil, which there is 2,000 milligrams of fish oil, but the actual omega-3 content of the fish oil, because it's not very well concentrated, is very, very low. So somebody who needs, let's say, 1,500 milligrams per day would have to take 3 servings of this, 6 soft gels a day. Then that's a lot of pills. Plus, you end up going through it faster, and then you're spending the amount of money you would be spending if you just got a higher quality product in the first place. So this is a very, very common kind of product issue we see when people bring in their products and are having problems. The next thing to look out for on supplement facts labels is something called the proprietary blend. So this is a little bit of a loophole that supplement companies can get away with, where they can call something a proprietary blend, and they are required to list out what is in the proprietary blend, but they are not required to list out the amounts of each. So for this instance, we've got borage oil, fish oil, vitamin E, and flaxseed oil, but we don't know how much of any of those are in there. It could be 90% of the first ingredient and 10% of the rest. It could be 20-20, who knows? Like it could be 25% of each, probably not. It could be a ton of flaxseed oil. We have no idea, and it doesn't list out any omega-3 content, EPA or DHA. So there's one thing I would highly recommend anybody stay away from. It is this proprietary blend. If you see this on a supplement bottle, just know that you have no idea the amounts of the things that are in that proprietary blend. Okay. So it's really important to keep a lookout for that on any supplement labels. in kind of keeping with the ingredients list, let's talk a little bit about those ingredients lists. So I'll go back here and show you. So other ingredients down here, you see this says gelatin and water. What they did was they put all of the ingredients here in this proprietary blend, so they don't have to list out any of the nutrients individually, and then they just added, whatever was left under other ingredients. So ingredients list must include what is not included on the supplement facts panel. And that's how low quality supplements will kind of get away with that, is that they'll put it all under this proprietary blend and then include the other ingredients. They'll get away with not having to list out the actual individual constituents of the supplement. And it may or may not, an ingredients list may or may not include the source of omega-3. So this could be the fish type, or if it's from something like an algae source, it won't list the type. Common other ingredients you might see in an omega-3, glycerin. This is usually made, it's the capsule shells. It's an inert ingredient. It just helps make the capsule shell. Gelatin, again, capsule shell. If you have somebody who is a vegan, gelatin is an animal product, so it's just something to be aware of. All vegan products, if they're calling themselves vegan, they will not be made of gelatin. You'll typically see the glycerin capsules because those are vegetable based. Tocopherols, this is vitamin D for antioxidation. Fish oil, omega-3s, they're a fat. So they do experience oxidation in the presence of heat or light. That's why fish oil bottles typically are very dark colored, and we tell you to store them in a dark, cool place. So you'll often see antioxidants that help keep the omega-3s from oxidizing. Flavoring. So sometimes, especially in liquid fish oil, you may see some added flavors, commonly lemon flavor. But there are other flavors you see out there. I think lemon or any kind of citrus flavor is the most common. But flavoring can be found in liquid fish oils. Again, no issue with that, especially if it is, meeting all the other requirements, but it's just something you may see some flavorings on there. And then rosemary extract. This is also an antioxidant, and again, often found in liquid fish oil, but it can be in capsules as well too. But rosemary extract acts as an antioxidant to help preserve fish oil as well. So these are just some of the common ingredients you may find in a fish oil. I'm going to go ahead and show you this next slide here. So I brought back that good supplement label I wanted to show. If you look here, so we have the sustainably harvested fish oil, and it gives you the source. So this is from anchovies, sardines, and mackerels. And then it says it's purified as a 90%, greater than 90% omega-3. And then it says the capsule shell, what that's made of, and then mixed natural tocopherols, which is that vitamin D as an antioxidant. This is a very well laid out omega-3 supplement label. And then on this product right here, again, you see no source of the fish oil listed. It just says the other ingredients because it's got the oops. It had the EPA and DHA up here. So again, because it lists the fish oil up here in the supplements, it's in the supplement facts, it is not required to be listed also down in the other ingredients. It can be, but it's not always. And so this is, again, one way they don't have to tell you then where they got that, where that sourcing is from. It's not a huge deal. That's a little bit of a personal preference. However, it is just important to note, if you're looking at an overall product. Again, I would use this product as a really good example. If you see 2,000 milligrams of esterified fish oil per serving, but when we add up the 360 and 240 milligrams of EPA and DHA, you're only getting 600 milligrams of omega-3s here. So again, you can put it in a big writing all you want, and people tend to look at the big writing first. That's why they do it. But it's not, that's not the dosage of omega-3s that you're actually getting. And companies do this because it's cheaper. They can get less concentrated forms of fish oil and sell it. It's cheaper, costs less money to make, and so they can make more money. on a suboptimal product. Dose. So we talked about looking how to find the dose on the bottle. How do you find your dose? Well, first is dose is very individual. Everyone is very different. So a lot of folks will ask after I talk about, looking at the supplement facts, well, how do I know what I need? Or what should I be getting? What is the optimal dose? The optimal dose depends on the individual. So this is why we recommend very heavily getting your omega-3 index tested, because you can find out where you are and where you need to be. So we have this dosing calculator on the Omega Quant website where you can go in and type in your current level, and then it will spit out a number at the bottom that will tell you your dosage. That dosage at the bottom of that calculator is that combined EPA and DHA amount. Okay. So if it says 1500 milligrams for you, you are looking for 1500 milligrams combined EPA and DHA. You can double up on a supplement dose. If you've got a product that has, let's say, 1,000 milligrams of omega-3s and you just need to take 2 doses, or if it's 2 pills, you can take 1.5 per day. That is okay to do. But there are products out there that can get you that 1,500 milligrams or that 1,000 milligrams or that 2,000 milligrams in per dose, and kind of decreases the amount of pills you need to take and things like that. There are a lot of factors that play into dosage: age, health status, high amounts of activity, your current omega-3 index, and weight. Heavier people may need more. So there's a lot of individuality, but getting your levels tested and then using the calculator to find out where you need to be is the best way to get an accurate idea of how much you need daily. All right. So just a quick summary here. Dose is the most important thing when we're looking at a product label. Okay. If I drive home one point, it is that when you look at an omega-3 product label, look for that EPA number and that DHA number. Ignore all the other omega-3 or fish oil numbers on there. They don't mean anything. They aren't useful for what you need when it comes to increasing your omega-3 index. We are looking for the EPA and DHA number. Be very aware of those proprietary blends. The third-party testing is always a plus. You don't have to choose a third-party tested product. I just think of it as kind of like a little bit of an insurance policy, knowing that what I'm getting is what I'm paying for, and not something that, I'm possibly getting other things in it or not getting enough of the active ingredient. And then one I didn't mention on here, but the last one is supplements have expiration dates too. Just like medicines, just like milk, just like food, supplements have expiration dates, and especially with fish oil can go bad. Good fish oil can go bad if it's left on a shelf long enough. So it is important to check the expiration dates of the products that you are taking. I would just make sure when you order a supplement from anywhere, but especially vendors like Amazon, places like that, or even you typically see this less if you're purchasing something in store, but even still, ordering anything online, especially from somewhere like Amazon, when you receive your product, just make sure it's not expired. Fish oil should not smell bad. It should smell kind of like nothing. If you open a bottle of fish oil and smell it, it feels like it hits you in the face with the smell. It probably has gone rancid. And if you should open it and smell it, it should smell like nothing. It shouldn't, or just like a light smell. It should not smell significantly bad. And so look at expiration dates and then just give your product a quick whiff before you start taking it, just to make sure that it hasn't gone bad, because fish oil is a fat and can go rancid. So I apologize for the little bit of technical difficulty we had at the beginning, but that is the presentation for today. So I think we're going to go ahead and take some questions. Please put your questions in the chat if you have any, and I'll be happy to answer them. All right, so I'll go ahead and look at the first question. I see a question here. Does this mean that individuals chew and break the capsule for lemon flavor? I thought that was for the antioxidant properties. So no, the liquid fish oil I'm talking about is actual bottles of liquid. They're not in capsules. So the lemon flavor is for liquid fish oil that is comes in liquid form, not in capsule form. The lemon is not typically used for antioxidant property. You'll see the that rosemary extract and then the vitamin E for that as well. So the lemon flavor is for like actual liquid fish oil and not capsules. I'm not aware of any that are capsules that are lemon flavored because you shouldn't be chewing those to begin with. Oh
Kelly,
yeah,
I'm back.
obviously.
Yeah, no,
Okay.
I was not able. So I was set up to where I couldn't be heard earlier. So I don't know if anybody heard me when I was doing the announcements, but
Oh, that's okay. We'll redo our announcement.
yeah, that's fine.
Okay,
Um,
people are saying, uh-oh. All right.
if you want me to
All
go through
right.
the questions, do you want me to go through the questions?
Yeah,
Okay.
sure. Yeah, I see a couple in here.
Okay. So what about plant-based omega-3? It says I've tried plant-based for years. I tested less than 4.0 when I finally got tested. The only way I can get to over 8, which is the starting point for healthy, is from eating fish and taking fish oil. Understood from my own research that many people cannot convert plant-based forms to animal form, which is what our bodies actually blah blah. Tried algae, krill oil, and I guess I'm wondering if this person tried enough algae.
Yeah. So that is a very layered question. And we actually did a webinar, 2 months ago, I think, on plant-based fish oils. So, we talked all about this, but to kind of answer your question as quickly as I can, because it's an in-depth question. The first is dose. So if you were taking an algae product, and same with krill oil, although krill oil is not plant-based, that krill are little animals. They're little shrimps, basically. Algae-based products tend to have lower doses. So you probably were not taking enough. That is probably most likely the thing that was happening is that you are not getting enough. Oftentimes, the average algal product may only have like 4 to 5 or maybe 600 milligrams combined EPA, DHA. If your level is at really low, like that 4%, I think they said, you need way more than that in order to get, you probably need upwards of like 2,000, I think off the top of my head, in order to get up to that 8%. So you probably just weren't taking enough. Fish oil tends to be higher in dosage just because it's easier to concentrate in that way, whereas algal products are not. As far as converting from plant to animal, that's a different thing. So converting, when people say that, they're talking about converting ALA, which is alpha linolenic acid, into EPA and DHA. ALA tends to come from things like walnuts, chia seeds, flax seeds, and there's other things that it comes from, but those are the kind of the big ones. Yes, we convert some ALA to EPA and DHA, but the conversion rate to EPA is like somewhere between like 4 and 8%, something like that. And for DHA, it's 0 to like 2 to 3%. It's really low. So, yeah, so it is, if you're going for a plant-based product, you need to get something that is algal-based in order to increase your EPA and DHA, and you need to get the adequate dose. So I know that's a lot of answer. If you have individual questions, by the way, if you're asking for yourself or individual questions about your, you can either send me an email. Becky can put my email in the chat. It's kelly@omegaquant.com. I'd be happy to answer individual questions over email. We also do offer consultations. So if you go to our website and go to, I think it's under resources, or no, it's under shop. You can book a consultation if you've had a test, and we can go over your results and go over individual circumstances. So I want to try to stick to over questions that we can answer for everyone. I don't want to do individual consults here in the in the webinar. So let's try to stick with questions that are
Yeah, and we have a
apply to everybody.
lot coming in both in the Q&A and the chat. Are there any
Okay.
issues with blood thinning with higher doses of algae oil or algal oil?
So this was thought to be a thing for a long time with fish oil and alcohol oil. There was a big worry over blood thinning. However, there have been several meta-analyses, like high quality, very large meta-analyses studies that have come out within the last, like I'd say, like 5 to 10 years, showing that bleeding risk is not a concern for fish oil and algal oil, even at pretty high doses, like really high doses. There was a meta-analysis done, I think it came out like 2016 or 17, looking at cardiovascular surgical procedures and with crazy high doses of fish oil. And the people that were on the fish oil actually were at lower risk of bleeding than those who were not. So it's been pretty well put to bed that bleeding risk is not a concern with fish oil supplementation.
Is it true that omega-3 should not freeze when put in a freezer?
I mean, if you get it cold enough, anything will freeze. So probably your regular freezer, no, it shouldn't freeze solid. At least I don't think so. You don't have to store fish oil in the fridge or the freezer. You can if you want to, but you don't need to. And so you just don't want to keep it somewhere that is like hot or in sunlight. So don't set it on your kitchen counter in front of your window. Bad idea. The two places where people really like to store their fish oil, which is like the kitchen and the bathroom, are probably the two worst places to store fish oil because they're exposed to a lot of temperature variations and light. So if you're going to put it in like your kitchen, put it in a cabinet that's away from your window, away from your stove, kind of on the other side of the kitchen. That's the best place to put your fish oil.
Are you aware of any unflavored kid-friendly omega-3 supplements that would be easy to hide into foods for autistic kids who are very particular regarding texture and flavor?
Good question. So I can't recommend any specific brands. I can't do that. However, yes, there are products out there. You can look for unflavored liquid fish oil. They do exist. That is, if you want recommend specific recommendations, just send me an email and we can talk about that. But yes, there are products out there, unflavored liquid fish oil. You can put it in like smoothies and stuff like that. I do find that especially if you're making like a fruit smoothie or something like a lemon flavor, it's not overly powered. There are some companies that do make like a berry flavor as well too that you could add to things like smoothies. That is less offensive and you're not going to notice it as much, especially if you put like something of more stronger flavor in the smoothie, like banana or something like that. You're not going to taste like an unflavored one, but they do exist. Yes, unfortunately, I can't recommend brands right now though.
Are fish oil supplements a potential source of heavy metal contamination via bioaccumulation in fish?
Yeah, so mercury concerns, yes and no. A highly purified product should not be a big concern for mercury contamination. That's really the big one, the heavy metal we're most worried about. Especially if we're looking at things from like anchovies, sardines, salmon. Those fish also just tend not to be very heavily contaminated with mercury. Yeah, so products that use those as a fish source. So that's why I said, like, looking at the ingredients list, the fish source is important. Or can be something to be concerned about. But if you're getting your omega-3s from other sources, larger fish like tuna, which I don't even know of any brands that do tuna, but that's where somewhere, it does exist. There is a thing.
Yeah, there are some companies that for some reason they put tuna in their oil, which is fine. But
fine. But yeah, tuna is more likely to be contaminated with mercury because tuna are really, really big fish. And if you think about the food chain, little fish eat the bigger fish, or the bigger fish eat the little fish, and then so on and so forth. And the bioaccumulation in the larger fish are going to be the most concerned. But salmon, anchovies, mackerel, those are smaller fish with lower risk of contamination. And the more highly purified they are, the less likely, lower their risk is.
So this person was mentioning about they have a product with green tea, with products that have other things, other ingredients like green tea, which is known as an antioxidant. Is that more to increase antioxidant content?
It could be. It depends on the product. If they're advertising it as like a green tea supplement, I'd be interested to see like what is that is it like a weight loss product or is it a heart health product? It really depends on what it is and what the dosage is. I'm not aware of like um, that being specifically added for antioxidant effect, but I guess it could be. Yeah.
Okay, a lot more questions. I wouldn't add any more questions to this just because we have 14 in the queue. We're probably not
Okay.
going to get to all of these, everyone. So again, if you have a question for Kelly, you can email her at kelly@omegaquant.com. This person has 3 questions. I don't know if we're going to try to answer all of them. One is, could
We'll
you
do our best.
indicate, or there's articles about omega-3 index and dosages. So Maria, I'm going to send you a copy of the study we published from our lab in regards to dosage guidelines based on omega-3 form that help determine the calculator and the effect of different forms on index. How do you define an optimal doses, I guess, for how long and when there is a deficiency?
So again, if you have to test. So optimal dose is for us based on your omega-3 index level. That is how we decide what your dosage is. Omega-3 index level responds in a dose response to, or a correct dose response to omega-3 supplementation, meaning the more you take, the more your levels will increase. So it's very individual. Someone who's starting off with a level of 7% will have different dosage needs than someone who is at 3% or 4%. So that's a very individual question.
Does it matter if it's pill or liquid form regarding potency?
No, well, yes and no. Liquids do tend to be a little bit higher in dose, just because they don't have to fit them inside a capsule. So if you really have high needs, you're someone who's really active, or just have a really low omega-3 index, and you have a lot you need to take. A liquid can be a little bit more efficient way of taking that. And but that doesn't mean that the capsules aren't a legitimate way to also get that dose. It's just also, it's a little harder because then you're having to take more capsules, which most people are kind of averse to taking pills. They don't want to take, 10 pills a day or whatever it might end up being. But as far as like, are they both good? Yes, it's just dose dependent. So a liquid may be a little bit more potent in terms of dose. But if you're getting that same dose in pills, it's basically the same thing.
Before we just continue for a few more minutes, I see people dropping off. So I didn't get a chance to announce this earlier. Be on the lookout. It's also in the early part of the chat, the Fatty Acid Symposium, our first annual Fatty Acid Symposium, February the 10th through the 14th. 10 speakers over 5 days. This will be presented by Omega-Quant and FARI, the Fatty Acid Research Institute. You can sign up now, completely free. There's no money. There's no registration fee. So that'll be 100% virtual. Also, January the 14th, at 12 Central, Dr. Bill Harris, our founder, inventor of the omega-3 index test. We'll be talking about SPMs, or pro-resolving mediators. We get a lot of questions about what are they? What do they do? What's the research say? So be on the lookout that. I will send out a replay of this presentation. You will not get a copy of the actual slides, but you will get a replay. Black Friday sale. If you are a healthcare provider, for Omega-Quant, you will get 20% off any additional purchases from Monday, November the 25th through Monday, December the 2nd. So be on the lookout on an email. You're going to be able to use the code, a specific code you will get as a healthcare provider. If you're a consumer, you will get 20% off any purchase on our website. So be on the lookout. And then finally, Omega-Quant University, the annual subscription for all of the webinars we've done over the last year and a half will be in there as a major university course where you can take all those courses. $99 for that subscription, but you also get a complimentary omega-3 complete test. That has a $99 value by itself. And finally, there will be no nutrition talks for next month to honor the holidays and to take a little bit of a break. And just to answer just a few more questions, Kelly, if you have time.
Sure, yeah.
Does it matter when you take fish oil? Should it be taken with food?
Yes, fish oil should always be taken with food. It should be taken with a meal that contains fat. So fat helps absorb fat. So any meal throughout the day, timing is not particularly important for raising your omega-3 index levels. So no, timing not so important, but it does need to be taken with food.
Which is better for increasing the omega-3 index, krill or like a high-end fish oil, like let's say triglyceride?
They both will increase your omega-3 index if you take them at the proper dose. Krill oil supplements do tend to be lower in dose. A triglyceride form fish oil is probably going to be better most of the time.
Is molecular distilled fish oil best for removing heavy metals?
I mean, yes, yeah, can you answer that?
Yeah, I mean,
Yeah.
so knowing from this industry and we, we have our own oil and going through a lot of knowing our raw material supplier, yes, that does help. I mean, most oils have very little to any heavy metals. And I can tell you, fish oil goes through extensive testing. Any good quality supplement brand, they're going
Right.
through extensive testing. Ask for their certificate of authenticity. They will give you a copy of that if they're a transparent company. So if you use a brand and you want to know, hey, is this brand tested? Ask your rep, ask the company, can I get a COA? They will give you a copy of that. It will walk you through the testing of all the things that are tested for and those levels. All right. Would inflammatory conditions generally increase the need for omega-3?
Yes.
Question about, there's a couple of authors that wrote a book on parent essential oils. They report an increase in prostate cancer when supplementing omega-3 from fish oils. Any thoughts on this?
I am not aware of that research. How about you, Tavis?
Yeah, I've seen some studies, and I think with a lot
Yeah.
of this, with AFib, with any of the disease states, I think some of the problems with a lot of the way those studies are designed, they're using processed oil. They're using ethyl esters, which we never want to use. It's not really good for the gut. They're less absorbed, less bioavailable. You have to take with food. They do increase your score, but I don't think a lot of these studies were well controlled, well designed. I believe Dr. Harris has debunked a lot of that research that we've seen before, and we've seen other individuals and professionals that have debunked some of that. But I don't know the specifics and outcomes of that studies, but I believe some of the oils used in a lot of these studies were not either using enough or they were not using a high quality form. Just a few more questions and then we're going to shut it down because I know we're 5 minutes past the hour. Let's see. Is cod a good source of supplementation?
Yeah, so cod liver oil is another one that you'll see a good amount of time available. And yes, again, all of this is yes, but if it follows all the guidelines I was talking about and meets your dosage needs.
Let's see if there is anything. I think that is just about it. Most of these are personal questions.
Yeah, if you have a personal question about your personal situation, my email is in the chat. It's kelly@omegaquant.com. So please feel free to send me an email. Or again, if you're interested, if you've got kind of a more complex situation going on, please consider booking an appointment with us. And we can sit down and go through your specific needs and your situation more in depth. I don't want to answer your personal
Well, thank you all for
in front of everyone.
Oh, Kelly, thank you so much. I apologize. Thank you so much for presenting today's webinar. Great information. Sorry, everyone, for a little bit of the hiccup. We're trying a new webinar platform in Zoom. I think we have a lot of the hiccups kind of taken care of, which is great because we're testing this before we go live with our Fatty Acid Symposium in February. So don't forget, February 10th through 14th. That link is in the actual chat at the top. I'm going to repost that in just a second. But you can actually register for that event now. It's 100% free. And then there will be 10 speakers over 5 days. So I just typed that in the chat. So be sure to get that. I'm also going to send that out when I send a copy of the replay. And lastly, just don't forget, take advantage of the Black Friday special. If you're using omega-3 in your practice, I'm going to type my email in the chat now. If you're not using omega-3 in the practice and you'd like to start, or you'd like to set up an affiliate account, or if you'd like to drop ship test, email me. If you'd like to white label test, if you'd like to use our supplements, email me. We can put together a package for you and show you how to do that and take advantage of that big sale coming next Monday, all the way through Monday, December the 2nd. Okay. Have a great day. If anybody has any questions, Kelly's given you her email. You have my email, and we will see you in January next year. We'll see you next year for 2025. So y'all have a great Thanksgiving for those that celebrate, as well as a good Christmas, and we will see you in the next year. Take care.
Thanks, everyone.